the world waits for Hamas to respond to a ceasefire proposal backed by President Trump and Israeli Prime Minister Benjamin Netanyahu, Gaza is facing another deepening crisis. In the south, hospitals are overwhelmed, medical supplies are running out, and extreme malnutrition is now affecting not only the patients, but the very own doctors and nurses trying to save their lives. One of those heroes, a critical care nurse, Elidalis Burgos, a volunteer at Nasser Hospital, where she witnessed the human cost of Israel's war.
As long as I'm alive and have breath, I won't stop fighting for you and fighting for the people of Gaza. Because this is just not human. This is not right. And so I fight for you for as long as I have a breath.
Elidalis is now back on U.S. soil, joins us this morning to shed light on what's unfolding inside Gaza's hospital. Elidalis, good morning. Thanks for joining us.
Good morning. Thank you for having me.
Okay, I have seen your reports. They're heartbreaking. Paint a picture for us of what life is really like inside an ICU in war-torn Gaza.
Yeah, when you first walk in to the hospital, you are first impacted by the amount of people who have been forcibly displaced from their homes. 80% of the building structures in Gaza have been destroyed, and so many people are displaced, living in tents, and then they're also living within the compound of the hospital, inside the hospital, in the hallways, and so it's very crowded. There's children running up to you, begging for food and water. As soon as you step foot onto the property, it's very heartbreaking. The staff there, the doctors and nurses there that have been doing this for almost 2 years now, have been doing this with really minimal supplies because of the blockade of humanitarian supplies, medical supplies, food, water, everything is barely existent, or very, very low supplies. Things as simple as gloves, antibiotics, having to ration care for children who are brutally injured. And normally here in any emergency department in America, we would just immediately jump on that child and give them the immediate aid that they need, and having immediately a code cart, and having blood supplies, and having everything we need to do everything for that child possible. And we're just watching countless children die of very preventable things due to the lack of food, lack of medical supplies, lack of gauze, just the most basic things for any healthcare worker to do their job, to save lives. And so if they survive the traumatic initial insult, whether it's a blast injury from a bomb or a gunshot wound to the head, then they usually die from infection or starvation. I mean, we watched people linger for weeks, in an ICU bed and just die of starvation. And so it's really, really awful. And I just really want to get the message out that humanitarian aid needs to be allowed in unrestricted, because it is having an effect on the entire population, bar none.
And those patients are the lucky ones. They're the ones that made it to the hospital, but their chance of survival after getting the care is not good, right?
Correct. Pretty much the patients leave the ICU. Most of them just die. They leave the ICU, deceased, unfortunately, because of these secondary complications that happen. Infection. We ran out of gloves. We're doing baths with cut up pieces of old mattresses, foam, to give baths, trying to do sterile wound changes when there's no gauze. Like, how do you do that? And then the other thing is food. So we watch these patients lay in the ICU bed lingering without an ounce of tube feeding, and anybody knows, you don't have to be a medical provider to know that with very, very critical wounds, you need healing and you need nutrition to promote that healing. And so we watch these patients linger in starving and without being able to aid in their comfort, because we also don't have pain medication to give them. So those horrific injuries that you're watching, I watch children 10 years old, 5 years old, be operated on without anesthesia. I mean, there's no excuse for that. There's no excuse to not allow medical aid in, and to not allow the medical workers to bring in things freely, because even things from our own suitcases were being thrown away that I don't see how they could pose any harm. Diabetic supplies or blood pressure medication.
And
How is this causing harm? And they're throwing it out of our suitcases, the healthcare workers that are trying to get in there to help. And so the message needs to really be pushed. And this is not a bipartisan thing. This is not a religious thing. We need to allow medical aid and food, water inside.
I know you
People are
mentioned this,
trapped.
that it's not just patients, it's the doctors too that are struggling
Yes.
with conditions and nutrition. I guess my last question is, there still hope in their heart in Gaza for these patients and doctors and the people of Gaza?
Is there hope? Of course, there's hope. I think the majority of patients, unfortunately, that are critically ill right now, I believe the majority of them will die. But for the people who are still standing, I feel there is hope for sure. I mean, one example of that is just they just want to live, and they're planning for a future. They want peace. They're looking to go to school and raise families, and so they're still wishing those things out loud. They just want to live, and so do they have hope? Yes, and I have hope that the American people can help push to put a stop to this. So there's always hope. Yes.
Yes, you got to have hope. Okay, intensive care unit, that's Elidalis Burgos. Thank you for sharing your story, so important, and we appreciate your time today.
Thank you so much.
Take care.